Good afternoon, guys. Today's discussion A discusses medical marijuana's true effects. Okay, so we're going to dig into that for A. So please join me for discussion A. Shocking new research reveals medical marijuana's true effects on your open page is tied to short video clip rather than a full written article. The surrounding page content provides only fragments, but enough to clarify the content. What the surrounding page suggests. The video originates from the Hearty Soul, a wellness-oriented outlet, and is framed as a quick explainer about recent findings on medical cannabis. While the page doesn't provide a full scientific breakdown, its cues point toward several key areas. The phrase "true effects" signals a myth-busting angle, suggesting that popular beliefs about cannabis may not align with what research actually shows. The surrounding text includes fragments like styles and concluded evidence is insufficient for the use of which applies. The research highlights gaps or limitations in the evidence base. Its categorization under health medical reinforces that the focus is on clinical outcomes, not recreational use. What the headline is doing. The language, shocking true effects, is deliberately dramatic. It's designed to grab attention, but the page context suggests the underlying message is more sober. Recent studies are tempering expectations about cannabis, showing that while it may help in some cases, the evidence is far from conclusive. Although the video itself isn't transcribed, the surrounding cues align with themes often emphasized in contemporary cannabis research. Promise with conveys. Cannabis shows potential for conditions like chronic pain, chemotherapy-related nausea, and muscle spasticity in multiple sclerosis, but results vary. insufficient evidence for other uses such as anxiety, depression, or sleep disorders. The data is inconsistent or too limited to recommend cannabis as a primary therapy. Risks and side effects. Older adults, in particular, may face heightened risks such as dizziness, confusion, or drug interactions when cannabis is combined with other medications. Need for rigorous trials. Much of the existing research is small scale or short term, leaving unanswered questions about long term safety and effectiveness. In short, the text introduces a video that claims to reveal what new research shows about medical marijuana. The shocking framing is more about attention grabbing, uh, retro, retro, retroic than a dramatic scientific breakthrough. The real takeaway is that cannabis is neither a medical cure nor a useless fad. It's a complex therapy with mixed evidence specific benefits. Real risks. Demand careful, individualized consideration. This kind of framing connects directly with connects directly to broader debates in health communication, how to balance public enthusiasm for cannabis with the reality that medical science is still catching up. For your work on aging, equity, and myth busting, this is a perfect example of how sensational headlines can obscure the real truth. Something worth unpacking in a podcast segment or toolkit for caregivers. Okay, guys, so that is A for you. I will be on in a couple seconds with B. Give me a few minutes to put that together, and I will jump back on and do B for you today. For now, get her wellness. Take care, folks.